Okay, we're going to continue on. We're still doing module 3, and this is lecture, I think it's 5, lecture 4 or 5. I can't remember right now. Well, this is the last one, the last lecture of module 3. So we're going to go into the skeletal system, which we started. We talked about the 5 functions of the skeletal system. Now we're going to talk about how to classify bones. Move these over. Okay. So we're going to talk about 5 different sections of bones. We're going to start with long bones. Okay. So for long bones, there are 3 components of a long bone. Okay. What are long bones, first of all? Long bones are, and I'm going to list them off when we talk about it, but they're anything that's long. See, this is a skeletal system. Can you see it? Yeah. These are long bones. The upper extremities, lower extremities. Anything that's oddly shaped, that's not long and straight, is not a long bone. Okay? We'll be referring to that picture, so I would turn to page 87. So that when we talk about 87 and 88, you're going to be, and 89, you're going to be talking about it. Okay, so 3 components of a long bone. You need to know this for the test. One is diaphysis, epiphysis, and the epiphyseal plate. Or also known as epiphyseal lines. Okay. Now, let's talk about the diaphysis first. Now, the diaphysis is mainly the shaft. The shaft is a long part of the bone. Okay. And this is known as compact bone that's seen in the shaft. This is an N. So when we talk about compact bone, what is the definition of compact bone? DEF stands for definition. It's dense bone matrix. Dense means close together, okay? It's organized into microscopic tubes of bone called osteons. Okay. So when we talk about the shaft, let me show you an example. This is on page 89, figure 3.10. You see this long part is the shaft, okay? And when we talk about compact bone, we're talking about how closely together the cells are, okay? And these long tubules that you see in there are osteons that make up the compact bone. Okay. The next thing we're going to talk about is the epiphysis, and that's right here. Okay, that's right here. Okay, and then epiphyseal plates are the growth plate. It's also known as a growth plate, and that's what you see here, where these space right here and the space right here. So epiphysis is right here, diaphysis is here, where the shaft, and the epiphyseal plate are these little spaces you see right here. Okay, right, or epiphyseal lines are right here. Plates here, lines here. I'll talk about the difference between plates and lines. Plates you mainly see in youth, in young kids. That's what's called a growth plate. Once it's all formed, you call it epiphyseal lines in adult. How do you remember this? I mean, I'm sure you've heard of growth plate, so that's what the epiphyseal plate is. Now, if you're talking about lines, think adult has an L in it, and epiphyseal line, that's an L. So that's a way to remember it. Remember the difference. Okay. Okay, so the epiphysis. So this, we talked about the shaft already. The epiphysis is at the end of the bones. Okay, and how we said that the shaft had compact bone, the epiphysis has cancellous bone. Okay, and what is cancellous bone? Cancellous bone is like a spongy type of bone. Okay, they're basically, so what it is it's a network of marrow-filled spaces. Okay, so there's marrow within the spaces of the bone, and that makes it have a spongy type of appearance. Okay, and that's known as cancellous bone. Okay. Now, it also is known as having this like a lattice-like appearance. Okay. Now the marrow that it contains within these little spaces, it can either be red marrow or yellow marrow. It could be either one. Okay. Okay. Now we're going to talk about the epiphyseal plate and lines. Okay. Now, between the diaphyses and the epiphyses is this plate and line. I just showed you the picture of that. You can refer back to your book on page 89 to show you exactly where that is. So I'm just going to abbreviate between the diaphyses and the epiphyses so I don't have to write the whole thing out again. Okay. And this, it's made up of hyaline cartilage in the youth, in kids. You need to know this. So when they're fully grown, and in youth, you also have the plate, okay? Right? So when they're fully grown, this hyaline cartilage becomes replaced by bone. And that's why it looks like a line afterwards, okay? So now this whole process, okay, is called ossification. You'll need to know this even in the coming chapter, okay? So make sure you know this well. Okay, ossification, what is this? It is bone formation, basically. Okay, now this whole thing is a test question. You have to know it. The question will be is to differentiate plate from lines and to give me all the points of it, and you need to know this entire thing. So make sure you know this is important. Okay, now let's go to the second classification of bones. Let's talk about short bones. Oh, I should give you an example of long bones actually. So it's going to be femur, fibula, tibia. These are on the lower extremities. So this is the femur, which is a thigh bone. Then you have the fibula, which is the little bone on the outside part, and the tibia on the inside. Here you have the humerus. And you have the ulna on the inside and radius on the outside. How do you know this? How do you differentiate and not get confused with ulna and radius? Because you're going to have a skeleton, but you have to label all the bones. So you'll need to know the bones. So if I did this is my left hand, okay? It's my palms facing up. If I look at it, I'm going to put UR. This is ulna and this is the radius, okay? Same thing if I did this, right hand, okay? UR, okay? U is on the inside, R is on the outside. That's how you know ulna and radius. So if I turn it around, it's going to be radius ulna. But anatomical position is always with your hands. Your arms are like this, okay? In this kind of format. And your palms are facing up. We'll talk about that a little bit later too. So we were talking about short bones, right? So short bones are, if you think of it like this, short bones are small bones. So if you look on page 88, an example of that is right here at the hand. Those, not all of them, but for the most part, all of them, these little bones in the hand, carpal bones. Those are called short bones because they're really small and little. Okay, so an example of that would be carpal bones. And then there's more. There's ulna, radius, humerus. You can look at the book and you'll see. Okay, so these are carpal bones. Okay, the next thing is, I'm just going to squeeze this under here for now. This one is flat bones. Okay, so flat bones usually have a little bit curve to them, okay? So they're a little bit curved. So if you had to pick that out, here are the ones that we're going to put, okay? And I'll show you a picture in a second. Okay, this is ribs, the skull, the sternum. The sternum is the breastbone, right in the center of your chest. The scapula, which is your in the back, your shoulder bones. Okay? And what is so specific about flat bones that you need to know? There is no epiphysis or diaphysis. Okay, so let's talk about this. Let me show you a picture. So the skull is right here, okay? The scapula, this is from behind, or known as posterior. The front is known as anterior. The back is known as posterior. These are the scapula right here, or the shoulder blades, like you've heard of that term. See the ribs? Those are all flat bones. Skull, scapula, ribs, your ribs in the back and the front, okay? The sternum, which is right here, okay? Now we'll move on to irregular bones. Irregular bones, they don't fit into any category, okay? An example of this is the vertebrae, which is your spine. So if you look at the book, again, the irregular bone, look at how that's shaped. There's all different kinds of shapes within the vertebrae. That's one single vertebrae. But if you look at the spine from behind, right here, all those vertebrae that you see, those are irregular bones, okay? And last, we have the sesamoid bones. So what is a sesamoid bone? Okay, these are bones that develop inside of a tendon. Okay, an example is the patella, which is the kneecap. Okay, now another example is the pisiform bone. What's the pisiform bone? It's in the wrist, okay, or the hand. It's one of the carpal bones. I don't have a clear picture of this on here, but even if you Google that, you'll see what comes up for that. So it's in the wrist, hand, and the tendon that it's in is the flexor carpi ulnaris tendon. Okay. Now, another example is the first metatarsal bone. And the first and second metacarpal bones. So tarsal means it's in the foot. Carpal means it's in the hand, okay? So when you say if you look at this picture, the carpals are in red. Okay, those are the little tiny bones. The metacarpals are these long bones right here that extend from the carpals, and then the phalanges are the ones that are basically your fingers. So your carpals are like in this area. Your metacarpals are these that go up to your finger. And then the phalanges are these, okay? So in the foot, it's the same thing. You have the tarsal bones where you see the red, the metatarsals right here, and your toes are the phalanges. Okay, so I'm going to go back really quick and just go over a little bit about the epiphyseal plate and line also, just to add in a point, okay, so that you know this. So in the youth, okay, let's just make a chart here. Okay, so the line, we said when it's fully grown adult, it's a line, right? Well, the epiphyseal line, the bone marrow that's present here, okay, there is yellow and red marrow, okay? Don't forget that's in the cancellous bone, okay? It's not compact bone there. Okay, and in the youth, because they're still growing, they need all the blood to give in the nutrients, it's red bone marrow. Remember we said yellow bone marrow contains adipose tissue. So in the youth, it's all red. Okay. Okay. So we'll keep moving on. Okay, so we're done with the classification of bones. I'm going to still talk about bone a little bit. So entire bone, okay, every different kind of bone is covered by a sheath known as a periosteum. Okay. Now this periosteum has two layers. Okay, there's an outer layer and there's an inner layer. Now this outer layer of periosteum is made of dense, irregular connective tissue, okay? It contains blood vessels and nerves. The inner layer, however, is a single layer of bone cells. Okay. Now, okay, we're going to talk about the skeleton. We're going to divide it into sections, and we're going to need to know this. Now, the skeleton is divided into two major sections. Okay. There's known as the axial skeleton and the appendicular skeleton. Okay. Now, the axial skeleton is the portion that supports and protects the head, neck, and trunk. Okay. Now, let me show you a picture to make you understand that. So what you see on the blue is the axial skeleton, okay? Head, neck, trunk, okay? These bones protect those areas. The appendicular skeleton, however, which is all the red parts, these are the portions, they're attached to the axial skeleton and has limbs attached to it. That's known as the appendicular skeleton, okay? You need to know the difference. Okay, so to understand this, again, it's in figure 3.11, page 92 in the textbook. Okay, and 93, you can take a look at it. Okay, so a couple of things you're going to need to know about joints, just some general basic knowledge. So the knee contains the patella that we talk about, which is a sesamoid bone. Okay, this joins the thigh muscle to the tibia. You need to have a skeletal picture in front of you to understand where these places are. If you're just writing the notes and not looking up the pictures, it's not really going to be that beneficial to you because you're not going to understand where the parts are. And this knee, this patella, acts as a lever. Okay, that's why you're able to bend your knee. Okay, now if you look at page, actually this is actually a good picture, page 94 figure 3.13. I talked about the tarsals and metacarpals and tarsals. It gives a much better and larger picture. You got to know this picture, how to label it. It's going to be on the test. So one thing you have to know, how many bones do you have in each hand? So there are 27 bones in each hand. And there are 26 bones in each foot. Okay, but this picture, you will need to know how to label it. Okay, so one thing you need to know about proximal and distal. Okay, these terms. Proximal means near and distal means far. So if I say the proximal phalanx, because each one is a phalanx, multiple is known as phalanges. If I say proximal phalanx, that means this is the proximal phalanx. If I say distal phalanx, that means the most distal, the farther away. Okay, that's why you need to know the anatomical terms. Now, let's talk about the skull a little bit. We're almost done with this chapter. Okay. Okay. Okay, the joints between the bones are known as sutures. Okay, and these sutures on the skull are immovable. They do not move, they do not budge. Okay, let me see if I can find, okay, here we go. These are sutures. See these lines that separate? All these lines that separate are sutures. Mainly, the main ones are sagittal suture. Let's see what else I show you on here. I guess that's the only one they're showing in the picture. Well, these different parts of the skull, I'm just going to go over it really quick. The front is the frontal bone, okay? Behind the eye, you have the ethmoid. The nasal bone is right by the nose. This is the parietal bone. This is how it looks like from the back. This is how it looks like from the side. Right around your ear area is the temporal bone, okay? And right below your head, at the very bottom and the back of your head is occipital bone. You need to know this part of the skull. These are going to be on the test. I'm going to give you coloring book pages that'll be posted up tomorrow, and you'll see the pages you'll have to do also, which will help you learn this. Now, the skull, this is the frontal bone, okay? From the side, you can see the temporal bone here. You have the nasal bone in the front. You have the maxilla, which is right here on either side of your nose. Okay, kind of going to your cheek, but it's not quite the cheek. The zygomatic bone makes up the cheek. Okay, and then the mandible is right here. Basically your jaw. See, if you look from the lateral, you can see the mandible. Okay. Okay, let's talk about the mastoid process. Now, if you go behind your ear, the bone you feel right behind your ear is the mastoid process. So, okay, there's a temporal bone is here. That's your ear. Right behind your ear or face, cheek, this is from behind. That's the mastoid process. That little bone you feel right behind your ear. Okay, this is the ear, where the ear is supposed to be. The mastoid process will be like right here, right behind it. Okay. So why is the mastoid process important? Okay. First of all, what is a process? Okay. A process, when you talk about a bone process, not the actual English word of process. So what this is, it's a projection on the bone. So why is the mastoid process important? Muscles, I'm just abbreviating muscles like M'(S), involved in the movement of the head are all attached here. That's why it's important. Okay. Now, this is also part of the temporal bone. So it's also a projection of the temporal bone. Make sure you know the skull bones, okay? For the test, you will need to know that. So page 96, figure 3.14, all of them. Know how to label it. Okay, so just for anatomical words, superior means above, inferior means below. Okay, so if you say something is superiorly, that means it's above, and this means below. Okay, now the maxilla, please refer to this picture. I'm not going to keep showing it in the video. You have the book, so just take a look at it. So the maxilla holds the upper teeth. And the mandible holds the lower teeth. Okay, and now something else you need to know about the mandible. This will be a test question. This is the only bone in the skull that moves. And you will need to know that. Now, other terminology to know. Let's talk about holes in the skull. Okay, or anywhere in the body. Meatus. Meatus is a passageway. So why am I saying this? The external auditory meatus. What is that? That's where your ear is, that hole in your ear that goes all the way in. That is a meatus. There's also something called a foramen, and that's known as a hole. Where do you have a foramen? A foramen is at the base of your skull. You can't see it because all your flesh and skin and organs are there, but it's the base of the skull where your cervical spine goes into the skull. Okay, there's an opening there, and that's known as a foramen, an example of one. Okay, then we'll talk about sinuses. Your sinuses in your face have pseudo, stratified epithelium. You'll need to know this. Okay, it's a hollowed, what is a sinus? It is a hollowed out space in a bone. That's why when you have sinus infection, sinusitis, that's an area in your face on either cheek that it'll feel sore, or above your eyebrows. That's where sinuses are present. And they can fill with fluid and or pus, and that can cause an infection. Or it's due to an infection, I should say. Okay. And then last, we're going to talk about the vertebral column. Okay, here's what you need to know for this. There are cervical vertebrae, which are in your neck. Okay. There are thoracic vertebrae. There are lumbar vertebrae. And there are sacral vertebrae, which also includes the coccyx. So I'll just include that here. Now, you need to know this for the test. There are 7 cervical vertebrae. There are 12 thoracic vertebrae. There are 5 lumbar. Okay. And then you have this, well, I should say I should probably just say sacrum and coccyx more than actual vertebrae. Okay. And then on all of these, the pokey part that you feel on your spine when you run your finger down your spine, they are known as a spinous process. Okay, that's what that's called. And there are certain parts of your spine that's convex, and certain parts that are concave. So let me show you that picture so you understand. So if you look at page 100 and figure 3.15, so you have the cervical vertebrae here, okay? Your head is attached to that. This is your thoracic, okay? This is your lumbar, and this is your sacrum, which is purple, and the coccyx is a tiny little bone at the very base in between your buttocks. Now, do you see how there is a curve? So here it's a little convex, okay? Here it becomes concave, this curvature, and this is convex. Sometimes when your muscles go into spasm, they are pulled tight and it changes the curvature of the spine. Okay, so it basically you need to relax the muscle so that the actual normal curvatures come back. So the vertebrae, the side bones that stick out are known as a transverse process. Okay. The articular process is up here, the pointy part of the top. And the transverse process is right here. That's the part I said that you could feel. Oh, well, sorry, no, this is the spinous process, sorry, is what you feel on your spine. So if you look at this page, you'll see the spinous process. See, if you run your finger down your spine, you're going to feel these spinous processes, okay? And then in between each spine is the intervertebral discs, okay? These blue things are the intervertebral discs. Sometimes someone might have a spine injury or back injury causing it to collapse, and there's no cushioning in between the spine. That can cause intense pain. It can pinch on nerves and cause other issues, okay? Now we're going to talk about the thoracic cage, which is basically the chest. And the reason they call it a cage is because the ribs are curved in such a way that it looks like a cage, okay? And we're going to talk about that right now. See this area of the chest, okay? Now, let's talk about this. There's superior 7 ribs. We have 12 ribs on each side, okay? Superior 7 pairs, and they're all in pairs. So 7 pairs of ribs are known as the true ribs. The inferior, which means bottom 5 ribs, okay, are known as the false ribs. And I'm going to tell you why. And you need to know this for the test. It will be a question. You will need to write out the difference, okay? The first 7 pairs of ribs, 1, 2, 3, 4, 5, 6, 7. They are all connected. These are all connected to the sternum. That's why they're true ribs. The last 5, 1, 2, 3, 4, 5. I don't even know if this is full 12 ribs, but I'm going to go back and recount it. But the last 5 are not, because they don't actually have an actual, so 1, 2, 3, 4, 5, yeah. They don't actually have an actual connection to the sternum. That's why they're known as false ribs. They're still a rib, they're just not connected to the sternum. So that's what, so the top 7 are true ribs, bottom 5 are not. You need to know that. Now we're going to go over the sternum. The sternum has 3 parts, okay? And you need to know this because you need to label it and you need to do it on a picture. So make sure you know this picture. The manubrium, okay? The body of the sternum and the xiphoid process. You need to know how to label this, so make sure you know that, okay? Make sure you know how to label that. Okay, so here's a picture for that. So this is a sternum in the center, okay? This is the manubrium sternum. This is the body of the sternum, and this little pointy little area on the bottom is the xiphoid process, okay? You need to label those parts of the sternum. Okay, we're done with module 3, and this is the last lecture, and I will be putting up coloring book pages on MSW.